The government continues to be on the receiving end of some criticism for its handling of the COVID-19 vaccine rollout. GroupUp Editor Nathan Geffen has said it might take more than 2 years to vaccinate just 20 million people at the rate we're going. Geffen has written a piece urging the Health Ministry to stop micromanaging the program. He joins us now to discuss this matter further. Nathan, thanks a lot for joining us this evening. So apart from micromanaging the rollout of the vaccine, you're also calling for an end of this voucher system, saying actually the voucher system is not needed. Talk to us about the reasoning behind that.
Hi, thanks for asking me to be on this evening. So in order to reach the government target of 40 million people by the end of February next year, we have to, from tomorrow, start vaccinating about 140,000 people a day, 7 days a week, all the way through to the end of February. It's a huge task, and people are struggling with this online voucher system. Government is trying too hard to micromanage the rollout of vaccines. Now, the Department of Health says it's going to be getting, that from now it's getting hundreds of thousands of vaccines, the Pfizer vaccine and the Johnson & Johnson vaccine, weekly into the country. If we're gonna have any hope of reaching a reasonable number of people, government has to let go. They have to let the private sector roll out. They have to let pharmacies and doctors make the vaccine available to their clients. They have to do imaginative things, like, for example, set up vaccine desks when people come to collect their old age grant or their disability grants. They should set up vaccine desks in malls, at taxi ranks, and they shouldn't have to worry about whether people have their ID documents. They shouldn't worry about whether people have signed up for their vouchers. That's all going to slow the program down. Let's just get the vaccine into the arms of people who are willing to get vaccinated. That's the aim. We don't have to control this thing as closely as government wants to control it.
And you're justifying that by saying that we've also had the flu vaccine, for example. So those that are in charge of vaccinating a significant portion of our population have been doing it for over a period of time, and that we should trust those who are entrusted with vaccinating with the job to do so, and government should just back off a little bit.
Yeah, I mean, every year I go into a pharmacy and I get my flu vaccine. It should be the same thing. If people want to go into their pharmacy and get their COVID vaccine, great, let them do it. Now, I think there's a lot of fear that there's not going to be enough vaccine. That is possible. That might come to transpire, and then that would justify some kind of control. But there's the opposite problem too, and that's that we've got all these vaccines, but we can't get them out into people's arms. And in order to do that, one has to release the control. One has to trust pharmacies, trust doctors, and also be imaginative, as I said. The Department of Health should be proactive and setting up booths at places where people congregate, especially where elderly people congregate. And of course, collecting social grants is a key example of that. They should also make sure that every single elderly care home in the country gets vaccines, and someone from the Department of Health to assist them administering those vaccines for the time that it takes to get every person living in an elderly home vaccinated. Yeah. It would be very easy to run a program over a couple of weeks to vaccinate every single person in the correctional services system, both prisoners and staff. These are imaginative things that government can do. The aim is to get as many people vaccinated as possible. The aim shouldn't be to control the program as closely as possible.
Well, never mind controlling the program as close as possible, Nathan, but then also it's around the commodifying of the vaccine, saying that actually that could lead to the black market getting a hold of a significant portion of the vaccine in itself, and the dangers surrounding that.
Yeah, so one of the recommendations we make is that government shouldn't be insisting that people pay for the vaccine, that pharmacies and doctors be paying for the vaccine. Just get the vaccine out to them. If government needs assistance with the cost of covering the vaccine, it should negotiate that with the big medical schemes, for example, to give them a portion of the cost of it. But we can't afford to create a situation where there's an illicit market for the vaccines by assigning a monetary value to it, so that people start setting up fake vaccine booths and distributing fake vaccines, or even stealing real vaccines. That's not a situation we want. If there's no monetary value associated with the vaccine, there's no possibility. Well, I wouldn't say there's no possibility, but it's much less likely to happen.
Yeah, and very quickly, before we wrap up, you also say expect a little bit of hiccups, because this is the first time that we're rolling out a vaccination program of this magnitude at this critical time, being a pandemic, and that we should expect some issues along the way.
Absolutely. I mean, it's very important, for example, that physical distancing and masks be adhered to in vaccine queues. Now, it's likely that in the beginning, that kind of thing is going to break down a little bit. We can't panic about it. We just need to fix it and push on with the program.
Nathan Geffen, editor of GroupUp, thank you so much for joining us.